One of my listeners wrote in and said, Dr. Boz, Dr. Becky Fitness has a food addiction test. Is it any good? So we looked into it. This is Dr. Becky Fitness's test, and we're going to tell you what I think about it and how do I score on that test. All right, the first question on her test is constant thoughts of sugar. And she asks, do you find yourself daydreaming about sugar or refined snacks? And do you find it hard to keep your focus off of them even when you're surrounded by friends and fun activities? Well, for starters, it's a great beginning for looking for food addiction. That the obsession with the thought of the food we crave the most is a number one best way to start for constant thoughts of food when I'm trying to sort out, is the patient addicted to food? So for the first question, do I have constant thoughts of sugar? The answer is no, but I relate. I've been there, and it is probably at a time when I was food addicted. Number two, do they sneak their sugar? Having sugar on your mind can also lead you to things that are out of character, like sneaking around to eat it. Another great question. This is absolutely common with addicts. They will hide their drug of choice. And in this case, that drug of choice is sugar. So for me, I probably would get a point for this. Yes, true confession. I did a book review for someone, and as a treat, they sent me a clean dark chocolate with sugar in it, like real sugar. And I totally keep it here in the fridge at the office. I won't take it home because I know my husband will totally eat it. If not me, the boys. So I think this qualifies. Sneaking sugar. I guess I'm still in recovery. Number three, you use sugar as a coping mechanism. Indeed, another perfect question. Again, when stress hits us, we look for places where we can easily escape. When we use substances, whether they are illicit or alcohol or even sugar, that sends a response into our brain of a pleasure hormone called dopamine. And when you have been addicted to a substance and you return to it, it does reward you with this pleasurable feeling of comfort. So, having been addicted to sugar in the past, do I still use sugar as a coping mechanism? I would have to say not often, but at times. If I look at the times when I seek food to feel comfort, it can actually be during a moment where I'm watching a movie and I see something I don't like. Either it's offensive or it makes me like cringe for personal reasons. I'll find myself getting up, walking to the area in the kitchen where I used to keep the pile of nuts. I know it's not sugar, but it's me reaching for the food that I used to have in that spot. So I have actually protected myself in many ways to keep that out of my list of coping skills, but this might be a half check. Number four, you need more and more of this sweet substance to satisfy your craving. Yeah, this is called a sweet tooth, and when they take one bite, they need the next, and they need the next. And it's for that same reason that I was talking about. You have dopamine that's been released, but because you're addicted and you keep pushing that dopamine button, your dopamine isn't giving you the satisfaction that you've had from that in the past. So it becomes I need a little more, I need a little more. And just like a alcoholic who now drinks 5 drinks a night instead of 1 drink a week, that's where addiction becomes a problem. So my score here is no. I've cured my sweet tooth. I've outgrown that. I really don't do this anymore. Number 5, eating sugar when you're already full. That desire to eat a bowl of ice cream at the end of the day or a big sugary treat when your stomach is full, well, that's not uncommon, but it is not appropriate to do that. The act of eating actually stimulates your appetite, and it's not uncommon to say, oh, I just want a little something at the end of a meal. But it should be easy for you to say no. And when your brain just doesn't let go of that thought, and it kind of ruminates that I need to have something at the end of the meal, I'm already full, I really don't need this, but the thought just sweeps over your mind. That is what happens when you're addicted to sugar. For me, this is not a problem. I do not suffer with this. Number 6, a history of binge eating. Binge eating actually has a definition where they consume excessive amounts of food in a short period of time. It often results in feeling of severe discomfort afterwards. In fact, that's why it's often accompanied with bulimia, where they vomit out the food after they've eaten it, just to relieve the pain. This is a very extreme version of addiction, and it is particularly common when these previous things on the list are an issue, where they obsess over sugar. They keep trying to feed that feeling of comfort with sugar, and now they just keep thinking the volume is going to satisfy me. This is a no in my history. I do not binge eat. Well, Dr. Becky is spot on so far. Her number 7 says afternoon slump, and what she's referring to is that when you are eating high sugar foods and you've been doing this obsessively, like an addict, you have a slump a couple hours after you eat your meal. And of course, what's happening is the same chase that happens with insulin resistant patients, where they put sugar in and their body says, hey, don't do that. It's very inflammatory to do that. Quick, save them. And the body puts that sugar out of the bloodstream. And that rise in sugar, followed by a dramatic drop in sugar, says to our brain, hey, you might want to just take a little nap. And that's an afternoon slump, highly associated with people who shoot their sugar up only to quickly sweep it out of their blood. And I agree, this is a very common sign of sugar addiction. As for me, I do not struggle with this. In fact, the last time I can really remember this being a true issue was I was pregnant with baby number 3, and although that was my best pregnancy as far as insulin resistance goes, the end was a little rough on me, and sugar became very lovely the last week before I delivered that baby, and man, I was still pushing life pretty hard, and I can remember that a patient did not show up in the middle of the afternoon, and I said, I'm gonna go take a little nap. Come get me when the patient shows up. And I totally laid down on the exam table and took a nap. Yeah, so I've had this, but I do not have this anymore. Keto really has made this absent. Number 8, you feel better when you eat sugar. These people do have a sense of relaxation. In fact, they're the ones who say, but doc, we need carbs to survive. Or, doc, I just cannot fall asleep unless I have a little sugar at night. Doc, I save all 20 of my carbs for right before bed. And I'm like, naughty, don't do that. So as for me, I can feel better when I eat sugar, but I don't do this. Moving on to number 9, she says, experiences withdrawal when you don't have it. Boy, oh boy, does she have this right. With any addictive process, whether it be a substance or a habit, when you take it away, people crave it, they withdraw from it. And particularly with sugar, well, they get crabby, they get irritable. Patients really struggle with this. They have the headaches and the malaise and the fatigue and migraines, just overall mental fog and not wanting to do life. It is a very real set of symptoms. And it takes days, sometimes longer, if they keep sneaking and putting the sugar back in before they really get past this. Personally, I don't have withdrawal. Even when I have a little bit of sugar, I still don't have withdrawal. And her number 10 is you feel the need to rely on willpower to avoid sugar. Yeah, definitely another really good question to sort who is addicted versus not. And, in all my years of taking care of addicts, everybody tries it. They try to white knuckle it. They try to just will themselves away from something that has co-opted their life. And it's a lonely path. I will tell you, my answers for patients has long been, we have some really great chemistry sets that don't allow you to be addicted. They come with some rules about how the body works and which way that system is heading and how to get it to head in the right direction. When you get your endocrine system on your side and that chemistry set really working for a better brain, a better energy, a better motivation, Willpower is a wimp compared to your chemistry set. So, my number 10, nope, I do not use willpower to avoid sugar. Dr. Becky's site didn't have a score for me to say, well, am I addicted? I think I got 1.5 points if I'm looking there. I'm sure that there are seasons of my life where I would have scored a little higher. So if we look at the DSM-5, which is the Diagnostic and Statistics Manual for Psychiatric Disorders, and specifically this looks at addiction. We're looking at addiction of substances or behavior that have become pathologic. Their list says if you got a score of 2 to 3, you would have a mild addiction. If you had a score of 4 to 5, we'd have it as a moderate addiction. And if it's 6 or greater, it's actually a severe addiction. My score of 1.5, I am not addicted to sugar. But I really want to know, are you? Put your score in the comments below. I'll come along and talk you through it.